So the successful part of this is that we were able to get the repair done successfully without any injury or complications. So a hernia is actually defined as a hole in the abdominal wall. So there's multiple different linings of the abdominal wall, including skin, fatty tissue, muscle tissue, kind of a thick collagen lining, and then everything on the inside. And if you develop a hole anywhere in that lining, that's defined as a hernia. The two most common types of hernias are umbilical or belly button hernias, and the other most common type is groin or inguinal hernias. In women, another very frequent type of hernia is what we call an epigastric hernia, which is basically a hernia anywhere above the belly button in the upper part of the abdomen. Typically, all hernias develop either along the middle of the abdomen, right along the midline, or again in the groins. And those are all the most common spots of hernias. A hernia is caused by multiple different factors. The most common factors that lead to hernias are any kind of increased pressure or stress within the abdominal cavity. And that can either be due to chronic straining from constipation, chronic coughing, obesity is another risk factor. Pregnancy is also a risk factor again in women just because of the increased pressure during pregnancy. The main symptoms that come along with a hernia are a bulge and pain. So one of the most frequent things that actually gets confused for a hernia is a groin sprain or strain. And that's basically where the ligaments or muscles of the groin area actually get pulled and create pain. And the chance of it being a true hernia is much lower. Our hernia is clinically diagnosed by a physician mostly on exam. So when you come in to see your doctor, based on the physical examination of palpating the lump or seeing the lump and the associated pain or tenderness with it, that's usually how most hernias are diagnosed in the medical setting. Sometimes, depending on the patient's body habitus or the location of the hernia, they may be somewhat difficult to actually diagnose on physical exam, and in that case you may need some imaging studies to help identify the actual hernia.
The first 2 surgeries were very painful. I can remember it. Every moment of that, I can remember it. With Dr. Choudhry's surgery, I honestly did not feel that same level of discomfort at all. There was very little discomfort.
Usually the treatment for an inguinal hernia is surgical repair. And we talked about, again, the different approaches for that. There is an option of doing an open surgery and a big cut and an open approach to the repair. And then there's also minimally invasive approaches to repairs, both either laparoscopically or robotically. And so I recommended to him that we do a robotic repair of his left inguinal hernia. So we were able to find his hernia, we were able to patch his hernia, and we did it without creating any injury. Again, there's increased risks and complications involved when you're dealing with a recurrent hernia. So the successful part of this is that we were able to get the repair done successfully without any injury or complications.
I can't tell you how elated I am to feel normal. After 3.5 years, I'm starting to feel normal again. So I'm really excited.